Okay. So as a runner, runners are basically a repetitive type of exercise. You're going over and over, same action, same movement, and same stress. When runners, interesting thing about runners is that they go look at miles per week. They want to put it in 30, 40 miles, and that's a lot of miles on their body. So if you don't have right biomechanics, you're going to have, compromising tissue, and then you're going to, break down tissue. And the tough thing about runners is that they want to continue on running when the tissue is breaking down. The most important thing about exercising is the recovery. You've got the compression component of it to break down the tissue, and then the secondary is the recovery. So then you're always coming back to 100%. So when you're in the running world, you're thinking about just thinking miles, and then you're pounding, and you're kind of going into that world of overtraining. You're trying to destroy tissue more so than rebuilding. So when you look at that side of it, you have to either, slow down, rest more, or speed up the healing. Speed up the healing is that side of that topical stem cell, right? So topical application, you want to quickly regenerate. You want to quickly, get that back to normal. The neat thing with topical is that invasively speaking right now, it's all about injections, right? You go through the skin, you inject that tissue that's compromised, and then you get it delivered that way. But the tough thing with needles is that you get that injury site from the needle. So then you got your own injury, and then the second one is that needle injury. So then you have to recover from that. That's why they say stem cell therapy, you need downtime like 1, 2, 3 weeks, and then doing nothing, and then you get back at it. Well, when you look at active people, they don't want that. They want to get going. So topical, with a transdermal component that can pull those information signals down through the skin into that target tissue, it gets to that tissue to start its process for its signaling. The neat thing about that is no downtime. You can continue on going. So as a runner, this is fantastic. It's almost like you want to think the three stages, right? You got the prehab world, then you got the injury and the post, right? The rehab, right? So you want to look at much as possible at the very beginning. You want to prevent injury so you can continue on. And that's another use of this.
Okay. And she continued. She had some good questions here. One of them, the other one is about testing. Did Was this actually tested on people? Um, like, was it everybody, or was it just white men doing the original testing? Reason being is because vitamin D deficiency, as an example, was tested, but mostly on fair skinned people. And so, as darker skin, it just kind of looked like we always had a deficiency. So it's just out of curiosity, how was that tested?
So we had a random 80 patients. So we had our first test, and I didn't put that category of race and ethnicity in there. So just going back, I know we had everybody in that thing. I mean, it was just there was athletes, there was weekend warriors, and then there's different females, males, and their races. So there's a mixture in there. But we just went after low back pain, and we went after pain as far as before and after. We had a 51% reduction of pain with regen. But as far as that specific question, that's a great one. I haven't really looked into it, but I definitely know that vitamin D with, with darker skin, people think that you don't need to be in the sun. Well, you still need to be in the sun. That's the tough thing. So, yeah. So it's interesting about that. I think there's a big case about that too, about
Hmm.
a study about, African Americans that don't go in the sun because I don't know, maybe I don't know what the reason is, but their higher chances of vitamin D deficiency is greater because of that fact.